Hello everyone, I'm Jiabao Wu. I'm a family nurse practicing nurse student. Do you snore at night? Do you feel tired, fatigue, lack of energy during the day? Do you have unrested sleep? Do you have to wake up frequently at night? If you have these symptoms, then you may have sleep apnea. Go to talk to your doctor. What is sleep apnea? Sleep apnea is a condition that people stop breathing for short periods while sleeping. It has two characters, including obstructive sleep apnea and central sleep apnea. In central sleep apnea, people stop breathing because their brains do not send the right signals to their muscles to make them breathe. People with sleep apnea may not know that they stop breathing while sleeping, or they wake up gasping for breath or being heard snoring. What are some symptoms of sleep apnea? It includes loud snoring, tiredness, and daytime sleepiness, restless sleep, waking up choking or gasping, morning headaches, dry mouth or sore throat, waking up frequently to urinate, waking up feeling unrested, trouble thinking clearly or remembering things. People with sleep apnea can be from little kids to young adults to older adults. Young adults may complain more about snoring and daytime sleepiness. Older adults experience more about dozing off while watching TV. The risk of obstructive sleep apnea increases with age. How does sleep apnea happen? During sleep, muscles surrounding the throat are less active, causing the throat to narrow. Obstructive sleep apnea means a completed blockade airway without airflow. Partial obstruction with diminished airflow is called hypopnea. Some people may have both sleep apnea and hypopnea. Obstructive sleep apnea or hypopnea causes decreased oxygen levels and increased carbon dioxide in the body. The obstruction wakes people up briefly to catch up on breathing. Some people may awaken completely with a sensation of gasping or choking. People with sleep apnea may not be aware of their abnormal breathing in sleep because they fall back to sleep quickly and don't remember the event. What are some risk factors of sleep apnea? Including increased age, being male, hormone changes, obesity, sedation from medication or alcohol use, abnormality of the airway that narrows it down. What can sleep apnea causes? It can cause reduced alertness, difficulty concentrating, and sleepiness. This will increase the risk of crashes, accidents, or errors. Also, it will increase cardiovascular risk like high blood pressure, heart attack, abnormal heart rhythms, or stroke. How is sleep apnea diagnosed? It is based on the person's medical history, physical exam, and testing. For example, larger neck signs, a small upper airway, complaints of snoring, and observe the stop breathing, choking, or gasping during sleep. About the test, the doctor or provider may order polysonogram. It is an overnight sleep study in a sleep study lab. If the patient prefers at-home devices, they can have the machine at home, the machine will monitor breathing, oxygen saturation, position, and heart rate. For home setting devices, a multi-night diagnosis has a better prediction than one-night diagnosis. According to the research, the Wellness Sleep Score has a better sleep apnea prediction based on the positive and negative predictive values, sensitivity, and specificity. The Wellness Sleep Score has 5 components. Family history of sleep apnea. Patients need to get up frequently to urinate at night. Narrow palate. And dental malocclusion. Based on the score, the minimum score is 0, maximum is 8. The higher the score is, the higher the patient has sleep apnea risk. So, how do we treat sleep apnea? The goal is to maintain an open airway during sleep. The most effective treatment is CPAP. It is continuous positive airway pressure. CPAP use and weight loss lifestyle modification will help improve the patient outcomes and reduce systematic inflammation significantly. For lifestyle modification, it includes weight loss, changing sleep position, avoid alcohol and other sedatives use. Besides sleep apnea, other treatment options include upper airway surgery and oral appliance. For CPAP, the machine will look like the picture like this. So as you can see, this person has a mask on his mouth and the tubing connects to CPAP machine. So the CPAP machine pressure will produce a continuous stream of pressure air that travels through air filter into the flexible tube. The tube will deliver purified air into a mask, and it is sealed around the nose and the mouth. When people sleep, the airstream from the CPAP machine pushes against any blockage, open the airway so people can receive plenty of oxygen from their lungs. What are some barriers of sleep apnea treatment? It is pretty common sleep apnea is underdiagnosed and underestimated. In many cases, people are not aware they have sleep apnea. So if you have any complaints or similar symptoms as we talk about, go to talk to your doctor and seek for medical treatment or advice. That is all about the sleep apnea. If you have questions, leave me a message. Thank you for watching. Have a good day.